We are starting with a part of the body that most people don't even think about. Here's a hint. You have two of them, and their role is to filter the blood, regulate blood pressure, and maintain electrolyte balance, among other things. This organ is not working well for about 37 million Americans who have chronic kidney disease, and that is life-threatening. Here's the crazy part. 90% of people with CKD don't even know they have it. Dr. Billy Gilbert II watched his aunt struggle with kidney disease, a family experience that shaped his faith or his path in medicine. He's a nephrologist with Renal Specialists of Houston, helping people to discover the disease early, which can make a life-saving difference. Good morning.
Good morning. Glad to be here.
All right. Dr. Gilbert, you're a Houston native. You grew up near the medical center, and
correct.
You saw doctors in those white coats and saw all the stuff that was going on, and that kind of sparked an interest in you.
Yes, I saw those doctors going back and forth to the hospital, and I knew I wanted to be one of them. I ended up going to the DeBakey High School for Health Professions, and over there we got an opportunity to shadow doctors and nurses at a very early age. And so after that, I was pretty locked in that I wanted to be a physician.
Yeah.
The thing I love about it the most is the patient interaction.
Yeah, at first you thought, though, that you wanted to be a pediatrician.
Yes. I wanted to be a pediatrician initially, and then what I like to call my origin story. You know, every hero has an origin story.
Right.
So my origin story is that while I was in medical school and when I thought I wanted to be a pediatrician, my aunt became ill with kidney disease.
Yeah, as fate would have it, right?
Fate would have it. She went on dialysis, and with my interactions with her and with my physicians and just playing the role of being a family member of someone with kidney disease, it showed me that there was a need there. And I locked in to become a nephrologist at that time. And it was a good decision. All of those interactions and experiences that I had, I'm able to bring to the patients that I treat every day.
Yeah, because chronic kidney disease, as I said earlier, 90% of people have no idea they have it. Like many things, chronic diseases are marching on for a long time before we're made aware of it. By the time we have symptoms, we're in later stages. All right, so let's go through the kidneys gradually lose function. They stop filtering waste and fluids in the blood, and that can lead to all kinds of bad things in the body.
Absolutely. So kidney disease is really a silent disorder. So we have to focus really on early detection and prevention. So if you have risk factors for kidney disease, which are diabetes, high blood pressure, family history of kidney disease, age of over 60 years of age, African American, Hispanic, or Asian
are more susceptible.
heritage,
yeah.
You're more susceptible. You really need to make sure you get tested sooner than later for kidney disease.
All right, so end-stage kidney disease oftentimes is what people hear about, and that's when you know are dealing with dialysis or dealing with transplants to survive.
Correct.
But there's a lot of stuff you can do before you get to that point. But if symptoms do present themselves, what types of symptoms should people pay attention to think, are my kidneys functioning well?
Yeah, some of the symptoms can be nausea, severe fatigue from the toxins building up. You can also have retention of salt and water, so you can have ankle swelling or leg swelling, or even shortness of breath at very late stages.
Yeah, now here's the problem. Everything you mentioned mimics 100 other things that people may be dealing with. Fatigue, I just need to get more rest. Swelling in my, that's just aging, that's just whatever. That's why it's so important to get a correct diagnosis. What does a diagnosis look like when someone goes in to get that?
Well, there's two major tests that need to be performed in order to diagnose kidney disease. There's a blood test that can tell you the percentage kidney function, and then there's a urine test to look for blood or protein in the urine.
Okay, all right, and those are easy, non-invasive things to do,
Very easy tests to do, blood test, urine test, and if that comes back abnormal, you need to call Renal Specialists of Houston, get in with us immediately, and we can come up with a good treatment plan.
Yeah, because there's a couple of things you can do. You can possibly arrest that kidney disease, or at least put it in a maintenance phase.
Absolutely. There's many different treatments based on the cause. You may have reversible disease, but if you don't get checked, you will not know, and eventually that function can worsen to the point of potentially needing dialysis or kidney transplant.
Now, as we all know, that saying, an ounce of prevention is worth a pound of cure.
Absolutely.
What types of things can we do to prevent kidney disease?
Well, the first thing would be to try to prevent those two major causes, diabetes and high blood pressure. So we're talking about making sure you stay at a very healthy weight, make sure you have a healthy diet, low in sugar, low in fat. Make sure that you continue to exercise and drink plenty of fluids.
Yeah. All right. The thing that you offer as well, besides the treatments, is the convenience of it all. Because one thing, when people don't feel well, they don't want to go from place to place to place to place to have to take care of everything.
Absolutely.
So you are a compassionate specialist, care about full spectrum kidney care, from chronic kidney disease, acute kidney injury, dialysis, and even help transplant patients. So leading edge treatments, you have access to clinical trials. That's another thing that people might not be aware of.
That's correct, and that's something that's very unique with our group. One of my partners, Dr. Jun Yao, is over our clinical trial care group, And she makes sure that all of our patients have the opportunity to be involved in trials that are cutting edge, and so they have the best possible treatment.
Yeah.
And there's also a stipend that's offered with some of the different clinical trials in order to make it easier for patients to get to and from the clinic offices.
Yeah, 12 convenient locations in the greater Houston area. And again, like I mentioned, range of treatments. A lot of people think, oh, if you have kidney disease, automatically it's dialysis. It's not automatically just dialysis.
No, not at all. In fact, 98% of people with chronic kidney disease are not on dialysis. And with Renal Specialists of Houston, our job is to actually prevent you needing dialysis.
Yeah.
And we have those 12 different locations all the way in Humble, Woodlands, Katy, Sugarland, Pasadena, even as far as Baytown, to make it convenient for patients.
And in those advanced cases, you are holding someone's hand. You are a partner with them going through it.
I love that. I love doing that.
In fact, you said one of the things that you love about this area of medicine is that you really do get to work with the patient face to face a lot.
Absolutely.
All right. The patients are carefully monitored, and eligible patients get help in getting on a transplant list if that's what they're going to need.
Yes, and we at Renal Specialists of Houston feel like getting on the transplant list is the most important thing.
Yeah.
Doing that early, we know that patients who receive kidney transplants, they live longer, they do better, they most importantly have a better quality of life.
Okay, and then there's options for dialysis. You don't always have to go drive off someplace and do it. You can do it at home as well.
Absolutely, that's one of my specialties, is treating patients in the home. We have different dialysis therapies. One is called peritoneal dialysis, where you have a tube in your stomach, you cycle fluid in and out of your belly while you're sleeping, and that serves to get rid of those toxins.
Yeah.
Those patients feel better, they have better quality of life, they're able to work, they're able to travel, they have more time with their family.
All right, I'm gonna go back to the problem though. The problem is this: a lot of people watching right now have kidney disease and would tell you, no, I don't feel anything, I don't know anything.
Yes,
so
yes.
again, who in particular should get checked? And it's hard to tell people to get checked for something when they're having no symptoms.
Yes, so let me go over those risk factors one more time, and everybody pay attention. If you have diabetes, if you have high blood pressure, if you have a family history of kidney disease, if you're over the age of 60, if you are African American, Hispanic, or Asian, you need to get tested right away. Those two simple tests, blood test and a urine test.
And just so you know, all right, thank you so much.
Thank
I know
you.
Your mama's so proud of you. I said, you're the second. He goes, yeah, my mama said, we're not going to call you junior. When you hit 50, we're not calling you junior. We're making you the second. Okay, so if you or someone you love has risk factors for chronic kidney disease, you might want to get tested. Call Renal Specialist of Houston at this number at 713-791-2648. Again, Renal Specialist of Houston, 713-791-2648, or visit them online at renalspecialist.com. They have 12 convenient locations in the greater Houston area.